I'm Asa Schaefer. I'm a physical therapy student.
And I'm Julie Fry. I'm also a physical therapy student.
And this is our 67-year-old patient. She's mute. So, to start out, we're going to give you the reasoning behind the assistive device that we chose, which is going to be a rolling walker. Since our patient is a 5-day status post left hip fracture, but she has been assigned to physical therapy for eval and treat with a pending discharge of 48 hours. She tested within normal limits of upper extremity strength and lower extremity strength of the unaffected side, so as well as having static and dynamic standing balance of a good, or a 4 out of 5. So we thought a rolling walker would be sufficient. It'll allow her to maintain her weight through a broader base as opposed to a cane or a quad cane. So to use this specific rolling walker, to fold it for any storage use or to put it into a vehicle or so, you press on the hinge there and the hinge on this side and just simply fold it in. You can store it whatever under a bed, in a closet, in the trunk, and then again to bring it out for use, unfold, make sure it's locked, and it's ready to go. To fit to the patient, walkers have holes down at the bottom. You press in the button, take it to whatever height you need it, and then make sure that the button pops back out. You adjust each side the same so that when you flip the walker back over, right side up, its bars are level, parallel with the floor. To fit specifically to a patient, you want to make sure that the handlebars are even with the greater trochanter of their femurs, so that when they're using it, they have approximately 20 to 30 degrees of elbow flexion throughout most of their range of use.
Okay. So now with the appropriate gait pattern, the gait pattern that we chose for this patient is a modified 3-point gait. That's because we chose partial weight bearing for the patient. So that means she can put a little bit, about 20 to 50% of her weight through her feet, but not all of it. So with a modified 3-point gait, the patient's going to stand like this with the upright position, and they're going to go ahead and roll the walker forward, and then bring their affected side forward first, and then follow through with their unaffected side. And so you're just going to go ahead, bring the affected side first, and then bring the uninvolved right next to the other one. So that's how a modified 3 would work for this patient. So we're going to go ahead and show you how to do a sit to stand. So first of all, we're going to go ahead and make sure the wheelchair brakes are locked in, this just as a safety concern. And then we're going to go ahead and we're going to put a gait belt on our patient as another safety precaution. And Ace is going to go ahead and hold a wheelchair just to make sure that it is secure. And make sure the gait belt's pretty snug on your patient. And go ahead and tuck in any loose ends. Does that feel good? Yep. Alright. So then we're going to go ahead and we're going to move the foot pads from underneath your feet. There's just some buttons on the side that you just have to push in. Go ahead. With our patient here, she has low blood pressure and low heart rate. So do you feel any dizziness or anything today? No. Okay, so we just want to make sure that she feels comfortable enough to stand up. Then we're going to go ahead and bring over the walker. Alright, so what we're going to do is we're going to get you up into this walker and we're going to practice our gait pattern. So we're going to have you go ahead and you're going to grab onto the handlebars right here with both hands. And then you're going to push now don't do it yet, but you're going to push yourself straight through with your hands. And then you're going to go ahead and you're going to grab your walker once you're standing upright. Okay? Okay? Do you understand? I do. Okay, so you can go ahead and you want to go ahead and grab the gait belt for safety and go ahead and push through your arms and grab forward. Alright? So we're going to go ahead and we're going to check the fit just to make sure this is appropriate for her. So we're going to feel for her greater trochanter. That's about right there at level. And she has about 20 to 30 angle flexion degrees. So you're going to go ahead and we're going to just put a little bit of weight through your foot, and we're going to go your involved side leg first, and then step with both your unaffected. Okay? And then you're going to go ahead and take a wide turn towards the wheelchair. Go ahead, take a look. And then once she gets close to the wheelchair, she's going to have to bring it around so that her back is to the wheelchair. Okay, and then you can go ahead and back up until you feel the wheelchair against your legs. Alright, now what I want you to do is first reach for the armrest, and then once you have a hold, you can go ahead and lower yourself down. And that's how we would go ahead and do start physical therapy with our patient.